About half of Planned Parenthood's yearly revenue comes from government grants and reimbursement. Stripping the abortion giant of $500 million, that's billion with a B, is the main focus for pro-life groups right now. For more on what defunding Planned Parenthood would mean for women's health, we turn to tonight's panel. We're joined by Dr. Marguerite Duane, a family physician, fertility educator, medical director of a crisis pregnancy center, and an adjunct associate professor at Georgetown University. Catherine Glenn Foster is an attorney and senior fellow in legal policy for the Charlotte Lozier Institute. Thank you both for being here. Let's delve into both the medical and the legal aspects of defunding Planned Parenthood. Dr. Duane, will defunding Planned Parenthood hurt women's health?
Absolutely not. As you did note, $500 billion goes to Planned Parenthood, primarily through government grants and through Medicaid. If that money stopped going to Planned Parenthood, it could go to community health centers and other practicing providers that provide true, comprehensive women's health care. In fact, Planned Parenthood only addresses a narrow segment of a woman's health care needs. Women's health care needs extend well beyond their reproductive health. In fact, the most likely cause of death for women is heart disease, followed by cancer, followed by stroke. These are issues that Planned Parenthood does not address. As a physician who worked at a community health center and was a former medical director of 2 community health centers here in the DC metropolitan area, I can tell you from firsthand experience that community health centers can provide far more comprehensive, holistic, life-affirming care to patients from all walks of life.
Now, community health centers outnumber Planned Parenthood 20-1.
Significant.
So would they be prepared for this influx of women who would be going to them if Planned Parenthood is defunded?
You're right. In fact, there's a little over 13,000 community health centers and rural health clinics as compared to just 600 Planned Parenthood community health centers, 600 Planned Parenthood clinics. Community health centers serve about 25 million people, whereas Planned Parenthood only serves 2.7 million. So about 10% of what community health centers provide. So yes, indeed, that would increase the numbers at community health centers by another 10%. But if that funding could be directed to those community health centers so they could hire more family physicians, more nurse practitioners, they could easily absorb those patients. And again, not merely provide health services for women or sexually transmitted disease testing for men, but provide comprehensive health care for women, men, and their children, whether they're born or unborn.
Now, Planned Parenthood, Catherine, is the largest abortion provider in the U.S., but for someone who may not be pro-life, why should they also support the defunding of Planned Parenthood?
Yes, you're right. Well, as we've discussed, Planned Parenthood is getting more than $500 million taxpayer dollars every year and is operating at a profit of up to $150 million. And we can all agree that American taxpayer dollars should be used responsibly and for the common good.
Now, you recently released a report entitled Profit No Matter What. What were you looking at that looked into, possible fraudulent abuse of money in Planned Parenthood? What were you looking at and what did you find?
Yes, exactly. I have looked at dozens of state audits of Planned Parenthood and dozens of federal audits of state family planning programs and Planned Parenthood. And these audits alone have already uncovered more than $130 million in waste, abuse, and potential fraud. And this is simply unacceptable for our taxpayer dollars to be used for really just enriching the profits of our nation's largest abortionist.
So we've talked about how Planned Parenthood clinics don't provide that same holistic health care as community health centers. There's potentially millions of dollars of abuse and fraud, yet women are still going to them. Why is that happening?
You're right. Again, with 20-1 community health clinics versus Planned Parenthoods, you start to wonder what's going on. And you look again at Planned Parenthood's very deep pockets. They have the money to hire the marketing firms and to hire the PR gurus who can go out and brand them in a very woman-centric and friendly and open way, even though we know that women's experiences have not been positive there as a whole.
Catherine's absolutely right. I mean, Planned Parenthood's focus is how can we build our brand? How can we bring more people? So that's where they're spending their money, on the marketing. At community health centers, we're spending our money on caring for patients. So again, when I was medical director of 2 community health centers here in Washington, D.C., where we served an almost exclusively poor, low literacy population in great need, rather than spending money on marketing, we spent that money on developing programs. For instance, one called Celebrate Life, or Celebremos la Vida, which was a women's health care program. It was designed to bring women in, address their health needs, ensure they had their pap smear for cervical screening. We actually did mammograms on site. Unlike Planned Parenthood, which says they do mammograms, we did the mammograms, and we spent the money, invested it in a staff person that could help navigate and support these women to get those healthcare needs met.
Actually caring for the woman and being pro-woman. Dr. Marguerite, Duane, Catherine Glenn Foster, thank you both for being here.
Thank you.
Thank you.